Hi guys, thanks for tuning in. Today we're going to speak about one of my favorite procedures that I like to do, an endoscopic brow lift. This is an advanced technique that I've been working on and performing on my patients for over 15 years now to help rejuvenate the upper face using minimally invasive techniques while still instilling a natural look to my patients. To illustrate how this procedure actually works, I'm going to walk you through one of my patients that I perform this procedure on and kind of go through with you what an endoscopic brow lift procedure actually is. What is an endoscopic brow lift? An endoscopic brow lift is a minimally invasive procedure that elevates the brows to restore them to a youthful, refreshed appearance. Unlike traditional methods, this technique uses tiny incisions hidden behind the hairline, combined with an endoscope for precise tissue repositioning. The endoscope, which I'll show you shortly, is a very small device, essentially, that has a camera at the end of it. I like to tell my patients, it's not much larger than this pen here that I place through these tiny incisions, and I'm able to use a monitor and see everything up close in perfect magnified view to assess the anatomy, so I can carefully peel off layer by layer that I need to release the eyebrow off its underlying tissue. It's done in a safe and effective fashion, and I get to visualize everything through that endoscope. I like utilizing more than just two incisions because I'm able to do more of a complete release. I like to fixate my eyebrows to the new position with a series of sutures that I place not just here temporally, but also up here through what I call my paramedian incision, meaning the median incision is the one I make here, but this one off the axis on both sides is where I like to fixate up as well. So that's the key to a successful endoscopic brow lift that I perform on my patients. What are the benefits of an endoscopic brow lift? The benefits of an endoscopic brow lift that I perform is to address the problem. I'm not attempting to overcorrect the eyebrow to an unnatural shape or position. My attempt is to restore anatomy in a patient that has noticed their eyebrows fallen through time. And so my job is to rejuvenate the eyebrows. A lot of patients, more and more of the time, are finding me because of the work that I do, because they see it. They see my before and afters, and they see the patients that I've helped, and they've noticed the improvement is there, but it's also natural. And that's important to emphasize. The work that I do is not to create a hyper-aesthetic, unnatural look, but it's more about restoring the patient's upper face to where it was before. Let's go through a case example I want to showcase that underwent an endoscopic brow lift. So come here with me, let's talk about this case. She's a patient of mine that underwent an endoscopic brow lift, upper lid blepharoplasty and lower lid blepharoplasty. And let's talk about her at the beginning. She came, presented to me and said, "Doctor, I really wish to have some of my extra skin improved here, and I feel like my brows are heavy." After examination, we went through the process of what an upper eyelid blepharoplasty would do for her, and she wasn't quite satisfied. She really wanted her brow shape and position to be improved, and I agreed with her. Her brows were on the low set side, left worse than right. She had extra skin on nearly touching her lashes. You can see the brow fat pad, which is this tissue here, is resting right below her orbital rim. So this is indication for me that this is a brow issue. I can oftentimes tell just with photos alone if patients will benefit from a brow lift and upper lid bleph or just an upper lid blepharoplasty. In her particular case, that was my suspicion, but going through the consultation, I did confirm that by essentially identifying that the brows were low and there was extra skin. This is her before photo. This is her after 1 year later. And in order to address her issue, I made a temporal incision about a couple centimeters behind the hairline in this particular area. My incision is about anywhere from 2.5 to 3.5 centimeters in length. So it's not terribly large, but it's adequate enough for me to do my work through there temporally to release from here to here. So that's where I'm telling you that my results are far better when I do 5 incisions versus just 2 temporally, because I'm able to release the entire brow from here on outward with these other incisions up there. Temporal incision was made here. You can see she has beautiful, nice hair. There could often be some mild thinning of hair after surgery. It's not common, but the ways I reduce hair loss after surgery or minimize the chances of having hair loss is making my incision as clean as possible and in between the hair follicles. So I'm not cutting through hair follicles. 2, I'm avoiding excess cautery. Scalp bleeds a lot. Scalp, it bleeds so much that you wonder, is that normal? It's absolutely normal. So the goal is to use compression more so than using heat. Any heat will essentially kill hair follicles. So minimizing heat, minimizing cautery is the second way of reducing hair loss. Third is minimizing tension. I do not close with tension. How do I do that? Well, the most important way is I do triple layer closure. I close the deepest layer, which is called the periosteum. Then I close the dermal layer, and then I close the skin. So those are 3 layers that I close, and that distributes the tension along all layers, hence minimizing the tension at the point of where the hair follicles are. So the hair follicles will still get enough blood supply to allow for them to continue to thrive after surgery. Now, if there's a little bit of hair loss, usually it comes back after a few weeks to a few months, but that's not common. Moving forward, temporal incision was made here, and then let's go back to primary. So we have the temporal incisions made for the endoscopic brow lift. I release this area through that incision. Then what about all this? That's where I make another incision here and here, essentially right above her eyeball, her pupil, behind the hairline. Those are my paramedian incisions. That's where I place my endotime implants, way back there, once I've done a full release. But in order to continue to access everything, I'll usually make a small incision here, about 1 centimeter wide, to use my endoscope through all these 3 incisions up here to release the remaining part of the eyebrow. Now there's a nerve here, it's called the supraorbital nerve. You can actually feel it if you place your finger, and there's a notch there. And that's the nerve that gives sensation to your entire forehead and scalp. There's one here on the right side, there's one here on the left side. One of the most important reasons I use an endoscope is so I can directly visualize that nerve and vascular complex in that area, so I'm not just essentially injuring it, but I'm working around it. You want to have an effective release around the supraorbital neurovascular bundle. You want to release just to the right of it, you want to release just to the left of it, so everything comes up. If you do not effectively release here and here, you're not going to get a good long-lasting effect. So that's what's important about endoscopic brow lifting, is to allow for a beautiful release while visualizing these nerves. And with these 5 incisions, now I'm able to release the brow and then fixate it to where I need to. Now in her particular case, she does have a little bit more of a low set brow, more so on the left than the right. So when I'm doing my surgery, I pay attention to that. I make sure that the left brow is situated just at the point of the right brow to give a result like you see here. Beautiful shape, very natural. You can see a year later, she still maintains her brow shape, brow position. She has a nice natural aperture to her eyelid show, which is perfect. That was done with some skin removal. Now when I do a brow lift and upper blepharoplasty, the beauty is that I don't need to remove as much skin in the upper eyelids because I'm elevating the eyebrows. So the eyebrow comes up to a more rejuvenated shape and position. So the amount of skin that I need to remove is much less than in cases that I just had to do an upper blepharoplasty alone. And 1 year later, beautiful maintenance of her hair. You don't even see any visible signs of any incisions, which is amazing. Take a closer look at her upper eyelid incision, completely healed, beautiful result. I don't like to have scars visible out here. I like to hide my incisions just below the brow crease and eyelid and where the brow meet. I also did a lower lid blepharoplasty on her. These photographs don't really show the improvement there, but she also had a nice rejuvenation to her lower lids. But this is a nice, beautiful before and after result. Let's look at her other side. Right side, nice improvement, nice opening to her eyelid show. Again, beautiful maintenance of her hairline, no change in that particular area from these incisions that were made. An endoscopic brow lift is a completely transformative procedure that I perform. I witness it with my patients, day in, day out, and it's absolutely wonderful to see their reactions to how their upper face looks after undergoing an endoscopic brow lift with or without an eyelid surgery. There's an extensive amount of artistry and skill involved in performing an endoscopic brow lift, and it's been part of my career for the last 17 years to really hone in and become one of the world's experts when it comes to performing this procedure, performing it the right way, performing it the most natural way, so that my patients have a result that they are incredibly happy about, but at the same time still instills their natural beauty. And that's what I love about an endoscopic brow lift. And I look forward to meeting with you. If you have any questions, if you have any curiosity of whether this would be something you'd benefit from, or if you already know that you've done your research and that you're wanting to come see me, I look forward to meeting you with you in person, to going over the plan with you and really being part of your journey when it comes to rejuvenating your upper face.